Welcome to the Resolink coronavirus outbreak, actually number third in our series of conference calls and webinars to cover the coronavirus situation. Welcome, everyone. Just a quick note on housekeeping items. The slides will be available after the webinar. If you have any questions as we're going through, please use the chat function, and we'll do our best to cover those on today or follow up with you after the webinar. Just wanted to say a quick shout out and special thank you to the healthcare workers that are actually at the tip of the spear and helping us all. And I know it's sometimes a thankless job, so thank you to all of them and the support staff and everyone for helping out, keeping us safe and healthy. It's a real challenging environment, so thanks again for all your help. Speakers today, there'll be two of us. The first one would be myself, John Bovitz. I think probably I know a lot of you I've met over the years. I'm a senior director at Resolink, been here for several years and working with lots of our clients and prospective customers as well. And joining me today is Bindia Vakil, who also many of you already know. Just to give you a quick update, Resolink's been receiving, and Bindia in particular has been receiving quite a bit of coverage. You can actually see a recent published article, I think from last week in Harvard Business Review that she did with Tom Linton. She's actually was on earlier this week, spoke on live on Bloomberg TV. So keep an eye out, lots of coverage. And if you're interested, we can always send that to you as well as a follow-on. So welcome, everyone. From an agenda perspective, similar to our previous updates, we'll give an update in terms of what's been going on since we last spoke. I think it's been a week or two, and helping supply chain professionals understand the current situation, the current data that as we see it. We'll also give some of our opinions in terms of how you can, what you can do, how you can help yourself and your company, specifically from a supply chain perspective. And so we'll talk through that from an assessing, planning, preparedness, and action perspective. And then at the end, wrap up with some Q&A given time and as much as we can. So let's kick it off. In previous updates, we actually went through and identified from worst case to best case, and then how it compares to the H1N1 situation of the past. And as you can see, we're actually crossing off the comparison to H1N1 and crossing off the best case scenario, because we're actually seeing what we thought might be the worst case scenario. We're seeing some of that. I do think we want to, it's easy in this trying time to be, and challenging times to be, negative. I think we're also trying to take a very positive outlook. And I think as we go through, we'll highlight some of the positives that we're seeing as well. But in terms of what we're seeing, it is matching to sort of the worst case that we had seen. Bindia, did you want to comment a little further on where we see things in comparison to what we talked about previously?
Yeah, thank you, John. So as John mentioned, when we first started looking at this in our first webinar was actually in January 24th. And this is when we presented these three scenarios. We really were watching the recovery numbers. We really were hoping, just like we saw with H1N1, that once the initial fatality rate improved and people started recovering, that the travel restrictions and all that eased up. Clearly in the last few weeks, unfortunately, we're seeing that go in the opposite direction. And so now, we had talked about how we had the inventory build up that was giving us some initial relief. We're seeing the inventories dwindle. We're here nearing the end of March. That was about the inventory coverage we were looking at for certain industries. Some industries, there's still some more. And so their outlook is still a little bit better for the month of April. But if you are in one of the industries where you're basically at the tail end of your inventory levels, then you're really looking at allocations, putting customers on allocation. What is also really interesting, given that this is now a pandemic, no vaccine yet, and vaccine, we saw some news that vaccine trials have started. So we did see the time to develop the vaccine has shrunk quite a lot compared to historically, but we are reading that vaccine trials have to go on for 18 months to make sure that the vaccine doesn't kill people. And so that is something that we're now all watching, is how long before we can successfully declare that we have a working vaccine that is not going to cause harm, and mass produce it, because all of us will have to be inoculated in order to prevent large scale fatalities. So I think right now that's kind of the scenario we are all looking at. Definitely severe impact to supply chains. There's demand shock, there is supply shock across the board. It's a tough time for supply chain experts. John?
Yeah, I think also we're also seeing some positive around some treatments, leveraging some existing drugs that may help in the meantime. So I think some optimism, but I think we're cautiously optimistic at this point.
Yeah, definitely. That was some very interesting news out of India, that some of the doctors have had success using a combination of 3 drugs to treat some of the symptoms. So fingers crossed. I think the good news here is that we are a very connected world. Information sharing is a lot easier today than ever before. And there are a lot of very brilliant people working on solving this problem. And so I think, John, you mentioned what is kind of that silver lining that we can all look for. I think we all have to look for it in ourselves.
Exactly.
Go ahead, John.
Yeah. And then one of the other things that we're looking at too, we'll sort of walk through this methodically as we discuss it, but we actually see the overall case and death rate increasing, as you can see in the charts. The good news, again, you can always compare and contrast this to the kind of the bad news, the good news. The good news is that most governments now, I think with very few exceptions at this point, are now imposing strict measures to curb the spread. There's, as we all are feeling now, social distancing and other lockdown mechanisms to try to flatten that curve that's going up right now. And then the other thing that we're noticing pretty quickly is that Europe is basically on lockdown right now. US, Malaysia, Australia, Puerto Rico, just to name a few, have instituted more and more restrictions. We're seeing things tighten very systematically, globally. And I think overall, those are great measures, and hopefully we'll start to see some improvement. Bindia, did you want to comment on this?
Yeah, certainly. I mean, we see that the growth of cases as well as fatalities is accelerating. What we are worried about, as the pie chart shows at the bottom, is the percentage of cases that we hear this a lot. Hey, 80% of the cases, or 81%, are mild, which is absolutely true. And that's the silver lining here. What we're really worried about from a supply chain standpoint, particularly if you're in the life science, healthcare, medical devices industry, is those percentage of severe and critical cases. So what happens there is those are the patients who have either age or underlying conditions that end up having severe pneumonia or low oxygen, end up having to go into the ICU because they're getting to more critical stage, and now they're experiencing septic shock or respiratory failure. So once you hit the hospital, now you have we have demand increasing for medicine for healthcare workers. There's risk to the healthcare workers. Something John pointed out as well is that if our healthcare workers get infected, then we have a scenario where we have more need for them than ever before, and they're getting sick as well. And so it's also a supply chain. You know, you have demand, you have supply. There's need for more workers, and there's fewer trained people if they get sick. So this is what creates a supply chain disruption. Is the demand is high for medicines, for supplies within the hospitals, for staff and everything else, beds and bed sheets and like small things that you can think of that you need in order to take care of a patient who walks in the door. That's what we are watching, because that is the supply chain disruption we're very concerned about. And what the government is doing is to try to do the social distancing so that the pressure on the hospital doesn't all come at once, but kind of gets spread out.
So probably a big question on everyone's mind is what happens after all these lockdown measures and everyone goes back to work? Well, if what we're going to see right away now, as things evolve, is China is likely to go back to work first. That happened there initially, and the question is, and I think that's sort of the question on everyone's mind, is even for ourselves as we look, we're all in our offices, or excuse me, in our homes instead of our offices. Kids are away from school. All these issues have been placed on us. Now we start to see people, as things start to subside in China first and then the rest of the world over time. What happens? What happens when everybody goes back to work? Bindia, what do you think in terms of what you're seeing and what you're anticipating will happen once this all starts to unfold?
Yeah, so what we saw was really heartening in China was the flattening of the curve of new cases that were being declared. So I think a lot of the news are very optimistic that, oh, China factories are slowly going to be reopening, and we saw Apple is reopening their stores. But the reality, okay, so the reality is that it's not like we've beaten the disease in China. There's no cure yet, there's no vaccine yet. The result of why the cases have come under control is because of the extremely strict lockdown that was put in place there, which is telling us that that is possible and that is working. And all those extra hospitals that they needed to set up, they actually were able to take those down, which was great. The problem is the moment China comes back, this virus comes back. So the speed with which the government tries to get everything back up and running, the greater the acceleration of the spread. So what we're telling our customers is, and this is not, we're not infectious disease experts. This is a planning scenario that we are providing for supply chain experts, is that plan for continued capacity constraints in China. We're seeing that factories across the board are running at 50 to 60% capacity. Travel curbs are still in place. Slowly, Chinese factories are coming back, but for example, in in Beijing, the city government requires that the number of people in every office be no more than 50% of whatever the usual staffing is. The government is actually also taking a very cautious approach when it's time to clear some factory to reopen. And there are multiple sort of controls that have been put in place so that employees can gradually return. So this is one of the reasons why we're not going to see more than 50-60% capacity utilization happen within the next couple of weeks. In fact, the risk here, and this is a real risk, and it's very important that we all note that the regulations are that even if a single worker gets diagnosed, the entire factory could be quarantined. Okay, so just because we are hearing that the Chinese factories are coming back on, we can't breathe a sigh of relief. We have to continue to plan for the disruption, continue to take control of the inventory that we have in various places in the supply chain, and continue to control how we do allocations. So I think what we also have to sort of look at China and what is happening there, anticipate that second wave. In fact, the governments of Asia, they are already planning for the second wave. So we, as you can see in the blue line versus the red line, I mean, if you look at China has been reporting new cases, and they're all from people coming back into the country, right? So we are going to see this as China tries to reboot. There will be a resurgence of new cases as the lockdown, as people start interacting, there will be a resurgence of new cases, and therefore the government will not continue to reopen fully. They will continue to have some level of these containment measures, without which that wave will be, the number of cases will again shoot up a lot. So I think that's kind of the key, is just, I can tell you that this has been so economically devastating for not only for China, but all of us as well. I mean, we're certainly seeing that in what we're seeing across the stock markets everywhere worldwide. I mean, at some point, tough decisions will have to be made by governments everywhere, that hey, 60%, 70% of the population will get infected. The death toll could go into the millions. That could overwhelm our hospital and healthcare systems, versus we continue practicing the lockdown measures that have such a high economic toll. I mean, I can tell you, I am really glad I'm not in a position where I have to make these types of tough choices. And being a supply chain practitioner, I see the impact, the economic impact of the lockdown, but at the same time, I see the benefit of the lockdown as a human with family and loved ones. I feel very conflicted about these types of choices. And for all the administrators, the government officials, and people in charge of healthcare and these types of decisions, I actually feel, you know, my heart goes out to them for them having to make these tough choices in the weeks and months ahead.
Yeah, thanks. I think we're in agreement on that. As we take a look at kind of global manufacturing activity, one of the things that we at Resling wanted to illustrate, because I think we're in a unique position, we can look at lots of different risk factors, whether it's part shortages, workforce outages, or cannot deliver to customers, or capacity constraints, just overall shortages in general. So we're monitoring lots of different, they call it measures of risk. And then we're also looking across different industries. And as you can see, we have like a high level dashboard that we've presented here. The interesting thing, if you look at some of these different risk areas, including demand, from the demand side, we're actually seeing an increase in some areas. So some areas are green and also increasing. Obviously, the amount of red and yellow is concerning. And Bindia, how would you sort of, if you think about this and what this is telling us across the different risk areas, then by the different industries from high tech, auto, semiconductor, med device, pharma, healthcare, food, consumer goods, how do you think they're all faring, and what are you anticipating?
Yeah, so I mean, we talked about this a couple of weeks ago, where right now we see that there are part shortages that are very extensive, touching all industries, but there has been a demand shock as well. So for example, if a car company sells fewer cars, which by the way, we won't talk about automotive very much because they already had way more finished goods inventory in the dealerships, and so the demand drop there actually signals a much higher demand drop through the automotive supply chain because of the reverse bullwhip effect. But we see in consumer electronics, malls have shut down, people aren't going to shop as much. And so that demand signal to the to a consumer electronics OEM trickles through the supply chain and to a semiconductor company that is 2 tiers down, it can be a much bigger demand drop. So we're seeing that demand drop happening, and it's a demand shock, really, which unfortunately, because you have less demand, your finished goods buffer are actually going to last you a little bit longer than you were initially estimating it in the January and February timeframe. So the good, I guess the good news is that because there's less demand, which is actually a huge problem, by the way, on the supply side, your planning horizon has just gone higher. You will be able to use your inventory longer. Yes, your lead times have gotten pushed out because capacity is very low. All those things are true. Transportation continues to remain disrupted. Supplier allocations are happening across high tech, auto, semiconductor, etc. So whatever you were building or had as part of your build plan, you won't be able to build as much because your factories may be disrupted. Or in some cases, we talked about this last week, is some customers are shut down. So even if you're okay, your employees are working and your delivery and transportation network is fine, you can't deliver to a customer in the impact zone. So across the board, in these industries, we see a supply and demand shock. On the medical device, pharma, life science, healthcare, and even to some extent food side, we see more demand because of, again, the demand is increasing because everybody knows they need PPE and they know they need a certain equipment to power up, not across the board, but equipment to power up their ICUs and take care of patients. They need more beds. So there's a lot of items that people are planning for increasing demand. That demand signal travels through the supply chain, amplifies because of the bullwhip effect now. And so there's a higher demand for certain second or third tier suppliers in the supply chain. Food is interesting. There's a good and bad. Restaurants are closed, but people are walking into the grocery store and grabbing everything that they can. And so there is a high demand scenario there as well. And so just, because of that, that is causing faster dwindling of the finished goods buffer that we saw. Now in the life science pharma side, companies do hold inventory, which is why it's not completely red yet. I think this industry did have the ability to go up until the end of April, actually, even not across the board, because obviously the demand is going up, as I said, but there is some ability to switch out things and do a little bit of flexibility and also exchange, because the demand is not increasing across the board everywhere. If you are in a hot spot, so if you're a hospital in the Bay Area or in Washington or New York, you're in a hotspot where there are patients and growing cases and community spread. But let's say if you're in the middle of the country where not as much of community spread happening yet, you may not be seeing that scenario for yourself. So it's just very dispersed. So everything I'm saying, it's general across the country. It's not for any particular, it may not apply to what you're experiencing just because you may be in a special situation, like a hotspot. Yeah, back
On the lighter side, I think we can say some consumer durables or consumables or such as toilet paper and others are they're meeting that demand. I was able to get some recently, so I think they're starting to gear up, obviously, to meet the demand, and also some areas. My wife ordered yesterday from Grubhub to deliver, so it'll keep the local economy going a little bit more. So shout out to the restaurants as well. Yeah, and from just continuing that theme around kind of and I know Bindia, this is a something near and dear to your heart around the labor and the human element of this, but we're also seeing labor shortages, and when we looked at it, we've come up with some specific numbers around it and an outlook. Maybe you could talk a little bit about what we're seeing and what you're anticipating from the labor shortage and human aspect of this.
So So yeah, I mean, in general, factory labor, like I said earlier, people aren't able to come back to work. The lockdowns at least in China, have not fully reopened. In Europe now, we're seeing, actually, while we're still talking about Asia, Malaysia declared factories would be closed because they are starting to do containment there. That's a huge hub for the high-tech semiconductor, consumer electronics manufacturing as well. So very critical country for that sector. And then we're starting to see now in Europe basically become the ground zero at this stage for this event. And Europe is hugely critical for life science, pharma, medical device, drugs, and all of that, chemicals, a lot of chemicals. So not having workers come in means a lot more disruptions than we anticipate in that spreads now across where before we were seeing a lot of impact to high-tech consumer electronics and semiconductor type of industries. Now we're starting to see that shift, particularly as demand grows into those other sectors. On the labor outlook, continuing to see workers get very disrupted. People might leave to go work at some other company because their current employer is going through a demand downside. So we might lose some skilled people. And that's always a huge problem because when we reboot our companies and our factories after the end of all of this, we may have to do it almost from scratch because we might lose some key people. So people will make tough choices.
Yeah. Thanks, Bindia. And as we continue to evaluate the data, now we kind of branch off into look at the logistics side of things. And how are some of the main ports holding up and some of the logistics side? Can you maybe talk through that and what you're seeing?
The pandemic is putting a huge strain on all the just-in-time supply chains. Our ports have seen almost a 20-25% drop in cargo volumes. I personally have seen this. I mean, I've taken pictures and shared with my team. As I was in San Francisco last week, I saw a ship come by and it was empty. Normally, that same ship would be stacked high with containers. It was actually quite depressing. So the idea here is that, the container ships that visit the Chinese ports, for example, that you see in this chart, both what we measure as TEUs, that came down, and then some vessels didn't even make the port call. Because they knew that it was pointless to go, and so this is what happens is because those ships didn't make it to the port or didn't pick up the cargo, 3 weeks later they came to the US empty or half empty, or in some cases we saw 10% full, 10 to 30% full. That is now coming here at that level. So it's just our ability to replenish supplies is very low right now. And so again, more critical that we have a lot of control over our inventory. The other key thing is as we see the recovery start to happen, which again, we don't know exactly when that will happen, but what we should plan for. Well, one is the opportunity right now to point that out is low fuel prices means you could lock in some really interesting low cost contracts. So for the procurement experts in the room, that is an opportunity for you right now. And keep in mind though that demand for capacity in the coming months particularly may be very fluid because the shippers might put more capacity on more profitable lanes. And so that could continue to cause us disruption as we look at recovery as well.
All right, thank you. Now, this is an interesting topic. I know, Bindia, you and I have talked about this over many years across lots of conversations with lots of different companies around the globe. But how much will insurance actually help mitigate some of the risk and some of the losses? In your experience, obviously there's different types of insurance, which we cover here, but what's your thought and feeling on how companies are able to leverage insurance in this situation?
There are different types of insurance. So here we're covering property and contingent business interruption and trade disruption insurance. For the most part, property insurances typically will have a physical damage type of a clause, meaning you have to have physical damage at a named site, and that is covered for certain kinds of risks. So it may cover some kinds of risk, it may not cover property damage from others. But in this case, there is really no property damage. Your employees are not able to make it to work or not allowed to come to work because of government lockdowns. And as such, there is no property damage. So your property policies, I mean, you should read the fine print and see if there's a case to be made in some way, shape, or form. That's for the legal experts. Same with contingent business interruption insurance. You have to have named a site. There has to be physical damage. And it could be the site of a third party, like a contract manufacturer or a key supplier that you named as part of your as a contingency to your business. So, hey, if the supplier goes down or the CM goes down, my business is interrupted, so my losses should be covered. Again, that requires the site to be named, and it's only covered if there's physical loss. So again, check with your lawyers and experts to see if you have a case to be made here, but really no physical damage as such. Now, there's trade disruption insurance, which does focus on any kind of major losses or loss of earnings or additional expenses that you might incur, or in some cases, you might incur a contractual penalty where some of your customer contracts might ask you to take some of the liability for non-delivery or on-time delivery of your products. And so those types of things, because if they happen because of large-scale trade flows disruptions, then you may have some coverage from a TDI policy. So again, check with your treasurer and enterprise risk team to see what types of policies they have invested in. Really, you know, the best protection against supply chain disruptions is to always have a portion set aside to have a supply chain transparency and risk management capability, because, and actually, you know what, honestly, John, insurance companies love that as well. And we've heard this from all of the top underwriters and brokers, is they don't want companies to say, oh, insurance is my risk transfer strategy and I'm relying on that, because they don't want to be left holding the bags on all the losses. So they want companies to have a robust supply chain mapping and monitoring capability to supplement the insurance, and then the insurance becomes your true backup in case your regular supply chain execution can't provide, your risk management capability can, because it's truly a unforeseeable type of high impact event. Then they want to be able to control their risk as well.
And we've definitely seen over the years, I know both you and I, around having more data only helps from the insurance side. Obviously, the more visibility, the better.
And yeah, and John, on that, just to quickly mention, you know, one of the things Resolink does do with all of our customers is we do present on an annual basis to the underwriters and brokers about the supply chain risk program that the customers have built, how proactively they're managing their risk. And my team actually will create slides for the leadership to work with the underwriters and brokers. It's a great way to build confidence. We see as much as a 15% premium reduction. A lot of your site due diligence is done upfront on your CBI policy, and that has a huge benefit, because sometimes if you don't have that site named upfront and the diligence is not completed upfront, it can take as much as 2 years for the claim to get paid out. But having all of that information provided upfront and work done and completed, it means claims can be processed within 6 months.
Great, thanks. Now, from a financial perspective on the supply chain, this is, I know both you and I have a strong interest in this area, you know, especially going back many years. and have built lots of great relationships with the financial risk score providers or financial assessment providers. There are partners, Resilink's partners as well. And but you can see right about now having those programs and being able to assess particularly small company financial distress is really key right now, because as we start to, as you mentioned, we're as things are evolving, it's going to put more and more pressure on the small, particularly the small supplier, but I think a lot of suppliers across the board. Can you, Bindia, from your vantage point, can you give a little bit of color to this and what companies can be doing right now?
This is a really key thing. As John said, there are companies that Reslink partners with, like Dun& Bradstreet, Rapid Ratings. Rapid Ratings is really interesting because they have a really interesting methodology around collecting supplier financials from, especially valuable from private companies, which is what we are currently worried about, is all the private companies. And being able to get their financial health score, measure it and track it, gives a good way for, or a good baseline for your executives to then say, out of my 500 suppliers that are privately held, here are the 25 that I want to meet and track more closely. Now, it's super important to be able to prioritize, not only based on spend, which I think a lot of us in procurement, we make the mistake of using spend way too much. When it comes to risk management, you have to look at the revenue impact. You have to say this supplier is a small company, here's their financial score, and this is their revenue impact. If I lose this supplier, 1 billion of my revenue could be in jeopardy. Or if I lose this supplier, they make some single source parts worth 500 million. Why is that important? Because that's how you build your business case to protect that supplier. Remember, if a supplier provides you transparency on their financial health and you use that information to take business away from that supplier, you just jeopardize your transparency initiative. So the way we always recommend to our customers is, do not do that. Your transparency program should be used to build a more collaborative, trustful relationship, work side by side with the supplier and say, here are your gaps. This is what I would like you to improve. And here's how I can be a partner. So let me give you an example in this scenario. As the chart shows, this was a good survey, which was done for Chinese small companies in China, where 6,000 plus companies responded and said that 33% of them have 1 month of cash on hand, and the 65% total had no more than 2 months of cash on hand. Now, obviously, governments will step in. They will provide some debt relief and other things. Governments all over the world are mobilizing on this. We saw yesterday a huge package, the first set of relief measures from the US side, and more potentially are coming, is what we read. But in addition to that, there are suppliers in your portfolio who are very critical for you. And what I did successfully in my career when the 2008 bankruptcies happened is, because we were tracking all the suppliers by revenue impact, we were able to say, okay, this supplier is, we spend $4 million a year, but they're used on products that are $4 billion in revenue impact to our company. And there are 35 single source parts that we buy. Out of these 35, we'll be able to, we won't be able to find any other source or do anything else. So we were able to basically go place lifetime buys with the supplier. In another case, we had a supplier, and so to finish out that story, that lifetime buy story was really critical, because we placed millions of dollars worth of lifetime buys and ended up pulling the supplier out of bankruptcy, and they ended up having a really successful merger several years down the road. So this is a success story, how a customer can really help a supplier using the transparency provided by the supplier rather than hurting them, making them successful. Another one was where we actually had a contract set up with the supplier that we would basically fund them for a period of time, take a portion of stock as a way to help them. Again, it's on a case-by-case basis, but the way you make the case, and if you're a large company and you have the cash reserves, protect your suppliers that are critical to your revenue and your future success, and set up an emergency fund and use the revenue impact number to make that business case with your finance team.
Yeah, great, thanks. I think this area in particular is an area where I think a lot of companies have relationships with with basically a lot of our partners as well. And if they need connection points, if you don't have any the relevant connections to those providers, let us know. We're happy to help. But it's definitely I think a big area. In terms of, we also looked at force majeures, which we're seeing a specific trend on this. Bindi, maybe you could kind of comment on what we're seeing from a force majeure perspective and how that impacts risk as well.
Yeah, so force majeure is I'm sure most of you know, but force majeure is a legal contract clause. So if a supplier, the force majeure clause basically relieves a supplier of their contractual obligations and metrics and SLAs such as on-time delivery and others in the event of a foreseeable or an act of God type of an event. Typically, it covers things like floods and earthquakes and tsunamis and things like that. But sometimes the epidemics may be covered. Now, what is interesting to note here is if you're looking at that Financial Times article, this organization, the China Council for the Promotion of International Trade. So this is a quasi-governmental body, and last week they announced that over 3,300 certificates had been issued by them to firms in China that were worth $38.5 billion, meaning this wave of force majeures is coming. So it's an early warning to all of us. Now, we all know that these are unmitigatable circumstances in some cases. When your government tells you to shut down, you shut down. You don't have a choice. So you need to talk to your lawyers and experts. Are the force majeures and certificates enforceable in the U.S.? No, this is not something that is covered under US law or protected, but this is something that the Chinese government has in place. Now, what we have done in force majeure is typically, you will see that force majeure clauses just say, okay, we are relieved of our contractual obligations. Well, what ResLink has sent out over the last few days is to all of our customers, and I want to be very clear, this is not legal advice. This is not us giving you legal advice as to how to write your contracts. This is just best practice. You should talk to your lawyers. If you saw the note we sent out, where we're recommending that you use this opportunity to modify your force majeure clauses in future, and say that in the event of a force majeure, you as a supplier should be held to your recovery time objective, which is the recovery time that you collected as a ResLink customer during the supply chain mapping process. So if the supplier was given the scenario of a act of God type event, how long will it take you to recover? We ask this question to all the suppliers, they answer that. So that becomes their recovery time objective in the event of a force majeure type situation. That is what we are asking you to use as a best practice in your supplier contracts in future, as well as make mandatory some of the requirements around being more transparent, providing greater visibility around supply chains, and having SLAs around confirming impact during events. They all need to be part of your supplier SLAs. So that document was already emailed to customers. But again, I want to reiterate very clearly, it's not legal advice. We recommend highly that you consult with your own lawyers, modify it as necessary, and don't do it if they recommend you not do it for any reason. But this is the best practice. I have personally done this in my past life in procurement. With many suppliers. Sometimes you can't do it with all. So figure out who are the key suppliers that you would want to put a clause like that in their contract. But right now, force majeure is coming. In fact, Evonik already declared force majeure on certain amino acids, which are used in feedstock and certain medical and pharma type applications. And more will come out of Europe as well in the coming months.
Yeah, and that's obviously a key area that we notify as we see them as they get officially released. We notify our customers. Thanks, Bindia. That's I think that's another hot topic around this. In terms of global manufacturing output and disruptions, Bindia, we did put this together in terms of illustrating sort of the kind of the core stats globally. Maybe you could comment a little bit on some of the metrics and the data points that we're sharing here.
Yeah, so we talked about China extensively. I mean, there's everything in China, everything we build here in the US and Europe has something that comes out of Asia. I don't want to say China, but 100% of the products that we build in the US and Europe have, if nothing else, there's packaging that comes out of there. Or there might be second tier supplier that has some key single source dependencies in Asia. So I think in general, the global supply chain is disrupted, transportation is disrupted, humans are disrupted, our labor force, our workforce is disrupted across the world. Tens of thousands of sites are disrupted right now. So there will be some kind of a new normal, but we'll have to wait and see in the next few weeks how we can contain it, what the new restrictions or eases of, as restrictions ease, whether it's as China is doing, only 50% of the staffing can return, and you have to maintain certain social distancing measures while outside. There might be some things like that that maybe we will see as well in the US and Europe. As of now, it's disrupted.
Yeah, thanks, Bindi. And I think the other thing, and maybe you could comment, I think what we're also anticipating is that things will come online, and as we talked about, things may if it comes online, then there's something else occurred, another component of the supply chain, or another goes offline again. So there could be these. We're anticipating there'd be these waves of coming online, going back offline, or various components. And maybe you could comment on that. So I think a lot of people that I talk to on a regular basis sort of anticipate multiple waves coming out. It gets better, it gets a little worse, it gets better, a little worse, until finally everything subsides, at some point in the future. I think that's kind of the good and the bad of everything. All right. So I think some of this we have talked about, but giving a little bit more color and data points for everybody around the manufacturing dependence on Asia. Maybe you can touch on a few of these points.
Yeah, I mean, I think like I said, everything we touch, but something comes out of Asia, whether it's Japan supplying wafer material to South Korea and Taiwan, which Taiwan taking wafers and shipping to South Korea, or China making active ingredient chemicals that go into active ingredients that are purchased by countries all over the world, including India. India, for example, is a huge manufacturer of generics. And they've already put a moratorium on export of certain generic drugs. So as we see, the world is going to protect its own population. They have to. They don't want to export. And so we're kind of reliant on the things that we have for some period of time. And as John said, intermittently, we may be allowed to go back and replenish something or operate a little and then shut down again. So we should continue to see that across the world in the coming months.
And from a European manufacturing, we're also taking a look at and analyzing that, and with our finger on the pulse of kind of what's going on, what's getting disrupted across Europe. Maybe you can comment a little bit on what we're seeing.
Yeah, I mean, like I said, with Europe, there's a aging demographic in many of the countries in Europe. And so we are seeing a much higher case severity rate. We are seeing thousands of people going through, if you look at the worldometer by analysis by country, everybody sort of focuses on here are the number of cases, here are the number of fatalities, but you scroll to the right and you see how many severe cases are currently there, and you'll see how severe that situation is across Italy and Spain in particular, because there are several thousand patients admitted, and that's what's coming in the US. So these countries in Europe are huge hubs of life science, pharma, chemicals, and active ingredients. I mean, we buy stuff extensively out of Europe because a lot of times our life science pharma companies are very nervous about quality standards in Asia, and so they're highly reliant on their Europe supply chain. And so we're very concerned about all that caseload of severe and critical cases there means they have less to share and less to export here.
And I think what we want to do now is sort of switch gears. As we've walked through a lot of the data points, the risks involved, what we're seeing. What we'd also like to look to is what are organizations doing to help their planning. And Bindia, maybe you could talk a little bit about some of the things that we're seeing and some of our clients and what they are doing. And again, with the outlook of there is still, even though you may be in the middle of it now, we're all in this together. There's still things that people and companies can do to help plan more effectively and with an eye towards improving things in the future.
Yeah, absolutely. I think now it's to collaborate, collaborate, collaborate. I think that's the shortest answer I will say, because right now we need to pool information. It's not like information is not there. It's there. It's sitting in people's heads, in their laptops. We're not able to sit in a war room like we would have expected before. We are having to sit at home and do this. We may have invested millions of dollars to build a war room or an EBC and have high state-of-the-art equipment located in there, and it's sitting there empty. So leveraging cloud technologies to pool all the data that you have across all your experts, it's sitting in their heads or sitting in their laptops, put it all in a central place so that everybody can work off of it in the same set of reality rather than different sets of outdated reality. That's kind of the best way to characterize it. Make sure you collaborate and talk to your suppliers. They are very much part of your recovery. So this is one of those times where continuity of supply to you is revenue to the supplier. This is not a relationship where your interests are misaligned, like in a price negotiation. You both want the same thing. So make them part of the solution. And then, continuously monitor. This is still an evolving situation. So continuously see what's going on and adjust your plans.
Thanks. And I think some of this we actually have talked about in the past, but maybe you could touch on. And as I mentioned in the introduction, yourself and Tom Linton recently published a Harvard Business Review article. Maybe you can touch on this a little bit around kind of managing sourcing risk.
Yeah, you will hear this a lot right now. We should second source everything. The reality is we can't, for many reasons. What we can do to manage 100% of our suppliers is have a mapping and monitoring program that sort of scans the world for things that could bring down a supplier, because it's not realistic for us to second source everything or manage every supplier very closely. But remember that every supplier is critical to shipping product out. And so having a mapping and monitoring approach that spans your supplier base really helps you segregate and segment the supply chain, again, looking at it from a revenue impact perspective rather than just spend.
Great. And I think along those lines, I think we're, as I mentioned in the very beginning, I think Resolink ourselves is in a unique position in helping clients with this, given the ability to understand the supply chain, map it, monitor it, and help clients get advanced warning on a lot of this, whether it's a reactive or a proactive approach. And I mean, we can obviously, if there's any interest out there, we can cover more of this, but all the way from kind of monitoring and understanding what these things are doing. We're also, as you can tell, I think we've built a great community of this type of event, and we keep giving updates on. We're getting great questions. Unfortunately, we're running short on time, but I think the questions, keep them coming. We'll follow up with you and how, both our current customers and prospective customers around what we can do to help. And along those lines, Bindia, also what I wanted to cover today was some of the things that Resolink is doing specifically in healthcare, but then also with an eye towards the future and helping other industries, which I think is this is really exciting. So maybe you could touch on what we're doing in healthcare specifically.
Yeah, so as I said, there are huge supply imbalances right now in healthcare. There are hospitals in these hotspots that are struggling or that are seeing the spike in cases or expecting a higher spike in cases. So they have inventory for some things, they have the need for some other things, and there's a huge need for them to kind of collaborate, pool information, and pool supplies to the extent possible. And so we talked to a few hospitals over the last few days, and in partnership with Stanford Healthcare, we are building the exchange for the hospitals. We are offering this completely free for all U.S. hospitals for the next 6 months to help them with the COVID response. The idea will be to match up hospitals who have something and need something with others who may have the opposite problem, because we know that some hospitals are sitting on a huge inventory of protective gear, and it's not like they are covered on everything else as well. So the idea here is we will start to take pre-registration starting basically Friday. We are going to go to the industry, GPOs, distributors, hospitals, etc. Please help spread the word, because if you're local hospital and you have a connection through the procurement organization, there is no charge. This may save lives. And we at Resolink want our solution. See, we want to do our part. We see what a critical time this is, and if our solution and our capabilities here can help solve these imbalances and get some critical materials there, we're also proud to be part of the solution. So I think just a quick shout out. Yeah, so just there's a healthcare conference call happening, and we'll have participation from Amanda Chawla, who's the VP of Supply Chain at Stanford, and hoping to confirm Sean Powell as well for that next week. But we will be talking about that in early next week, Monday or Tuesday. I think just a real quick shout out. So John, at the end, if you go to the last slide, I just want to say, the long months ahead of us are going to be tough. I want to recognize the everyday heroes among us, those who are at the front lines. They're interacting with our patients, working long hours away from their families. And, even they even are managing a smile or a comforting touch when we need it. They're helping us patiently while they're exhausted and quite honestly, without a thought to their own personal safety. Here in the US, it's accepted. We always thank our armed forces, our police for their service, because they're risking their life every day. Well, with COVID-19, we have a new invisible enemy, and that enemy has put a whole new vein of people at risk and created a whole new type of heroes. They live among us. My dad's a doctor. He's in the at-risk age group. He has all the pre-existing conditions, all of them, and he is insisting on going to see his patients every day, refusing to stop. And I sent him all the metrics, everything, and he laughed at me and he said, "I know all of that." And the scary part is they know better than all of us the risk they are taking. So I'm angry, I'm proud, and I'm humbled by his resolve and the resolve of all of the people at the front line, the new set of heroes. So From everyone at Resolink, please thank them for their service. Our heads bow before them for their bravery and for their service. Thank you for all you do to keep us safe. John, back to you.
Yeah, thanks. And unfortunately, we ran up against the time. We did get, because we have such a great community, and thanks to all the participants, we will follow up on the questions and apologize for going a little bit longer. Obviously, this is such a trying time and a challenging time, but again, we appreciate all of you, your continued support in terms of participating in our community and our educational activities, and we will follow up with you. So thanks everybody, and again, thanks Bindia for the insights, and thanks everyone for attending.
Thank you all. Good luck.
Take care.